Hi, everyone. I know I spoke previously about fear and the management of fear and anxiety. I'm getting emails and communications from people that are now taking anti-anxiety medications and they're getting frustrated and they don't know what to do. I want to share experience I had when I was at Welsh Allen as their medical officer, and the first SARS epidemic had occurred. And there was a lot of fear about flying from our sales force. There were a lot of people worried about having close contact. And managing fear is difficult. And I wanted you to understand that we're trying to give different ways that you can cope with your fear. I did a little light reading on my interest in how the human brain behaves in fear. We do behave a little bit differently. We don't always hear the messages clearly. When we message, sometimes our messaging is confusing. So we have to be careful, as I mentioned before, about the nuances of the message and keeping the message simple. But I wanted you to know that you need to set your expectations that things are going to be a little bit different. If you remember when you went to an airport after 9/11, it was kind of eerie and people were afraid to fly. Now people are afraid of social gatherings, and going to the grocery store doesn't quite feel like it used to. It's a little bit eerie. There are people with masks on and people keeping 6 feet apart, and you look at some shelves and they're empty. It can be pretty traumatic. So try to keep it in perspective that we're going to get through this. It may take a little longer than we anticipated. Try to keep your sense of humor, try to relax, and help us flatten the curve so that we get through this all together. Thanks.